afternoon to everyone. I am Dr. Tejaswini from Dr. D.Y. Patil Medical College, Pune, and I am presenting an oral paper on the topic comparative performance of manual and automated urine analyzers, in which I analyzed Transacea, LoRa XL and UF4000 Sysmex. So we all know that urine analysis is the third most used in vitro diagnostic screening test, which is following CBC and serum biochemistry. It gives insights on the patient's overall health and a special view on urogenital system. International urine analysis guideline asks for two steps. The first is physical or dipstick, which is followed by microscopic examination if required. This manual urine analysis is very labor intensive and time consuming process. So keeping this point or problem in mind, many Indian laboratories has introduced new generation automated urine analyzers, which include microscopic analysis. So our aim was to compare the microscopy of manual urine analysis with automated urine analyzer, that is Transacea, LoRa XL and UF4000. A study was conducted, a cross-sectional observational study was conducted over a period of 2 months, which included 107 samples from patients who were admitted indoor and visiting OPD in Dr. D.Y. Patil Medical College, Pune. Exclusion was for the samples less than 15% for the study. So what we did is we took 15 ml of urine, which was divided into 3 equal parts. The first part was taken for manual microscopy, which was centrifuged, and a wet mount was prepared for the classification of cell by a pathologist. Then later 2 parts were not centrifuged, and those were inserted into the machine, and with the respective principles of both the machines, the cells were classified. Data was obtained and statistical analysis was done. Here we studied sensitivity, specificity, positive predictive value and negative predictive value for Sysmex UF4000 and LoRa XL for erythrocytes, leukocytes, epithelial cells, crystals, cast and budding yeast. We observed that LoRa XL, Transacea LoRa XL has a better sensitivity towards erythrocyte as compared to the other cell lines with UF4000, whereas UF4000 was slightly better with the sensitivity of the as compared to LoRa XL for leukocytes, epithelial cells, crystals, cast and budding yeast. Moving towards the degree of agreement, we see that when UF4000 was compared with the manual microscopy, epithelial cells show fair agreement, whereas leukocyte and crystals show moderate agreement, and budding yeast there was substantial agreement. Moving towards the degree of agreement with LoRa XL and manual, erythrocytes and leukocytes show fair agreement, and budding yeast show the similar result as that of UF4000, that is substantial agreement. Now moving towards the degree towards the correlation. On comparing Transacea, LoRa XL, UF4000 and manual microscopy, results for erythrocytes, leukocytes, epithelial cells and budding yeast were in correlation. But in crystals, LoRa XL slightly outperformed the UF4000. But talking about the cast, there was no correlation between both of the machines and the manual microscopy. So this is a comparison of both the machines, and we observe that the throughput of LoRa XL is slightly more as compared to UF4000, and also the memory of the machine is 5 times more as compared to UF4000. The footprint of LoRa XL is slightly bigger than that of UF4000. Talking about the principles of both of the machines, UF4000 Sysmex works on the flow cytometry. It produces scattergram of all the cells in the cell line and then produces the report. Whereas for LoRa XL, it works on automated urine and automated microscopy. It clicks 15 real-time images of the sample, and with the help of IRS, that is image recognition system, the cells are classified. So for erythrocyte, LoRa XL was better as compared to UF4000. The reason lies in the principle. As UF4000 works on flow cytometry, the scattergram produced by erythrocytes and budding yeast are similar. So machine is getting confused between those two cells. But the LoRa XL is mimicking a pathologist's eye. So it is differentiating both cells on the basis of image. Leukocyte and epithelial cells, UF4000 showed better concordance with manual method as compared to UF4000 LoRa XL. And for cast and crystals, there was moderate to substantial agreement of UF4000, slightly outperforming LoRa XL. And for yeast, both of the machines show substantial agreement. I would like to focus one thing, that this study was the first study in India which used both of this machine. So all of the literature I have are the machines with the similar principle but not the same machines. So I'm concluding my study over here that both machines, automated urine analyzers, Transasia, LoRa XL and UF4000, exhibited comparable performance and strongly correlated with manual microscopy, whereas LoRa XL shows slight better concordance in differentiating erythrocyte and budding yeast and also the type of physiological and pathological cast. Automated systems offer enhanced efficacy, accuracy and reliability, making them indispensable in modern clinical laboratory. However, manual microscopy can't be replaced in the samples which are abnormal or given as flagged by the machine.